Hello and welcome back to Rural Health for You and Everybody. I'm Amber Sorensen, the Marketing Director at Murray County Medical Center, and I'm here with Holly Mikkelson, the HR Director. Hello, Holly.
Hi, Amber.
How are you doing?
I'm good.
How about you introduce yourself for our listeners?
All right, sounds good. So I'm Holly Mikkelson, and I am the HR Director here at Murray County Medical Center. I have been here for just about a year now in this position.
Cool, sounds good. So, although this podcast is dedicated to rural health topics, obviously when we're kind of talking about rural health, we have to hopefully touch on the aspect of careers, hiring, HR, and that sort of thing for hospitals, rural health clinics such as ours. And so kind of along that vein, do you want to go into a bit of what the hiring process is like here at MCMC?
Yeah, absolutely. So typically when we are looking for an open position to be filled, we start out, of course, with advertising. A lot of our advertising is done not only through our local newspaper ads, but also Indeed.com. And we've also been reaching out a little bit more on socials like LinkedIn. I think we've been doing some stuff on Facebook as well.
Cool, sounds good. So if people wanted to say I'm looking for a job as a registered nurse, what might the process look like as far as getting started? Where might they go first?
Yeah. So first, if they're interested in a job here, they can always reach out via phone call or email if they want more information on the job. They can also submit an application and resume. That is through our website. They can also stop in and get a paper copy of a application as well. And then once that gets to us, we start the interview process. We like to start those interviews really as soon as possible once we do get an application or a resume submitted. And so usually that process takes about a week depending upon the individual's availability for interviews.
Very good. And what might some of the benefits for some of those full-time employees look like here?
Yeah, so talking about health benefits specifically, anybody who is working 30 or more hours per week is eligible for full-time benefits. That includes health, dental, vision, as well as quite a few fringe benefits, including employer-paid long-term disability and employer-paid life insurance as well.
Very good, very good. And what would you say, either from what you've heard or in your personal experience, might some of the benefits and or challenges of working in this kind of rural area be specific to healthcare?
Yeah, so, we are a pretty small community, which honestly I think that becomes a benefit because you tend to know your coworkers, you know your patients, sometimes a little bit more on a personal basis as well. That also comes with the challenges of just recruiting in the more rural areas. We don't have quite a big of an applicant pool as more of the metro areas. We also are located not too terribly far from, Worthington, Laverne, Pipestone, and Marshall, which can sometimes draw our applicants or potential applicants away into some of those bigger hospital systems.
Interesting. And what would you say is kind of, I guess, what makes MCMC different than some of those bigger health systems?
Yeah, so MCMC is actually a community-owned or a county-owned hospital, so we do have the benefit of not having, the larger hospital system. We are managed by Sanford, but owned by our county. So I do think that is a benefit, just the fact that we have a little bit more autonomy outside of the Sanford system with decisions that are made. We are also able to take advantage of the county benefits packages that are offered. All of our benefits are through the county versus like a larger organization like Sanford or Avera.
Very true. And kind of going off of that autonomy a little bit, how would you describe the culture here?
I think that it's a pretty great culture. like I said, you have more of that hometown feel. You know your coworkers, you live in the same community as your coworkers, your kids are attending the same schools, as well as with your patients. So you have that personal connection that you wouldn't necessarily have in a larger organization. One of the cool things that I've had with past new employees is as they're coming on and into the role orientation day, when we are introducing them around, a lot of times people will ask, oh, well, I know you used to work here in the community. Why are you coming here to MCMC? And the answer oftentimes is, I'm looking for, a family feel in my job. And I really hope that is something that we are able to offer all of our employees, and just a really welcoming environment.
For sure. And do you have anything else to add about the hiring process, healthcare careers, or anything like that in general before we wrap up?
Yeah, so with the hiring process, I touched a little bit on the application process and getting into an interview. Typically, once we interview for an applicant, we really are looking for someone who's going to be a good fit within our company and our facility and culture. So once we really find that person through the interview process, we really like to get moving pretty quickly to fill that role, which isn't abnormal when trying to fill positions. But we definitely recognize that a lot of people do have, notice periods that they have to give at other employers. So we absolutely honor that when getting people started. And we'll usually start with, the first day just being orientation, just going through all of the typical new hire paperwork, taking our new employees around to the different departments, introducing them to as many people as we can, definitely wanting to make sure that they're introduced to everybody and have a, that welcomed environment and feel comfortable coming in, on their next days while they're actually doing their on-the-job training.
Sounds good. Well, thank you for joining us, Holly. And if people have any questions for you or about careers at MCMC, they can reach out to you via email or call, right?
Yep, absolutely.
Sounds good. And you can call MCMC at 507-836-6111 or email hr@murraycountymed.org.